Getting in that early morning workout may not help you get a better night's rest. A study published this week by the Journal of Clinical Sleep Medicine says exercise has long been a prescription for insomnia, but it may not translate immediately into a good night's sleep. East Texas News' Shaylee Sanders has the details on this study, as well as some expert advice on how to help troubled sleepers get a better night's rest.
Doctors say a good workout may lead to a good night's sleep for people who don't have trouble sleeping. But for patients diagnosed with insomnia, it may take up to 4 months of an exercise regimen to see any change in their sleep pattern. Dr. Ghuge says the correct diagnosis can make all the difference.
If there are other sleep disorders that are contributing to the presence of insomnia, then it's truly not insomnia, it is something else causing the insomnia.
Like sleep apnea, for example.
Those patients get tired when they wake up because they're doing something else with their sleep.
Which is what the study by the Journal of Clinical Sleep Medicine discovered, that insomnia affects next-day exercise rather than exercise influencing sleep. So, how do doctors determine what sleep disorder you have? Dr. Ghuge often uses actigraphy. Patients wear a watch that monitors rest and activity cycles.
That helps us understand their sun exposure, artificial light exposure, exercise patterns, what else they're doing in their sleep.
Dr. Ghuge says consistent exercise can make a difference, but it's important to remember to go early enough where your adrenaline can wear off and your body temperature has a chance to cool down. He says the sun can also affect your sleep.
If you exercised in the late afternoon, the late afternoon sun exposure actually delays sleep onset.
The takeaway from this new study: don't give up on exercising even if you feel too tired to get out of bed. And make sure you're properly diagnosed to ensure the best treatment plan. Shaylee Sanders, East Texas News.
The author of this new study, a neurology professor, says it can take 4 months for patients with insomnia to feel the effects of a workout routine because they have a heightened level of brain activity. She says it takes time to reestablish a more normal level that can facilitate sleep.